Hi Mr Dobson, my name's Lisa. I'm one of the nurses from Western Sydney University. I'm here today to administer some pain relief for you. I believe you've got some pain. Can I just start by checking your details first, if that's okay? I'm just going to do my first patient check. Could you please tell me your name?
It's Kane Dobson.
Yep, and what's your date of birth, Kane?
The 31st of the 3rd, 1994.
Okay, and do you have any allergies?
Yes, I'm allergic to penicillin.
Okay, what happens when you have penicillin?
My face swells up.
Okay, that's not a good reaction. Well, I won't give you that today, that's great. I'm just going to check your armband if that's okay. Alright, so I've got Mr Kane Dobson. Your MRN is 0956 742 742, and your date of birth is the 31st of the 3rd, 1994. 31st of the 1st, 1994, and I can see you're allergic to penicillin. Alright, I'm just going to ask you one more thing. What is your pain score if the highest is 10 and the lowest is 0?
6.
6, okay. If you can give me a few minutes, I'm just going to go and check out your medication, and I'll be back in about 5 minutes. I'll leave the buzzer for you, and if you have any other problems, please give me a call. Thank you. Okay, excuse me, can you do my second check, nurse?
Sure.
I've got Mr Kane Dobson here. He's complaining of pain. The doctor's charted him some medication. If you can help, and I'll just go validate the order, then I'll get it ready. Okay. I've checked my patient's ID. I've got the correct patient. I've done my first patient check. I'm going to validate my medication order. I have today's date. I've got morphine hydrochloride trihydrate. The route is per oral. The dose is 7.5 milligrams. It's due 6 hourly. This is today's date. It's not yet been given. The indications for analgesia, the patient's got a pain score of 6 out of 10, printed by the doctor, signed by the doctor, and that's his contact details, and I've identified he's got an allergy to penicillin. Are you okay if I proceed?
Yes, I'm happy.
Okay. I've got the S8 key, so that's okay, and I'll take my trolley and equipment and I'll go to the cupboard. Okay. I'm now just going to refer to the MIMS book to looking at the therapeutic indications of the medication and the action. So I have a medication with the product name of Ordine. The generic name is morphine hydrochloride trihydrate. It is a opioid analgesia used for the relief of severe pain. Contraindications is opioid hypersensitivity, some GIT disturbances. It can cause constipation. Special precautions to note is for patients with respiratory depression and cyanosis. And again, precautions are abrupt withdrawal for substance abuse history, bowel disorders, again constipation, bowel disorders, and special precautions as a central nervous system depressant, particularly looking at the respiratory depression. Adverse reactions I would let my patient know about is GIT upset, including constipation, respiratory and circulatory depression. Okay, just looking at the dosage for adults, it's recommended that the morphine hydrochloride trihydrate should be given in doses of 5 milligrams orally every 4 hours with a range of 5 to 20 milligrams every 4 hours. Our patients ordered 7.5 milligrams every 6 hours, so that looks like it's safe within that range. So I will check my patient's SAGO chart looking at the respiratory rate and pulse oximetry to make sure it's safe to give that. Okay. Are you right to do my second check, nurse? Thank you. I've got my ward register here for my morphine hydrochloride dihydrate. Get that out. So the balance says I should have 100 mils of morphine. Just do my first medication check and then I'll do my calculations if that's alright. I've confirmed my patient, I've got the correct patient, there is no allergies, I've validated my medication order. I'm just going to do my first medication check. I have an order for morphine hydrochloride trihydrate. It's 5 milligrams in 1 ml. There's 100 mils in a bottle, not yet opened, and expires the 12th of the 23rd. I've got the sheet here as well, the world register for this, the S8 register. I've got morphine hydrochloride trihydrate, that's 5 milligrams in 1 ml, it's a 100 ml bottle. I've checked the balance and the balance says 100 mils and that's not yet open, so it should be 100 mils.
Okay.
Happy with
Yes,
that?
I'm happy.
Okay. Just going to do my first little working out. Just going to start doing my calculations. So the doctor's ordered 7.5 milligrams. I'm going to do strength required over strength and stock times volume over 1. Strength required, doctor's ordered 7.5 milligrams. Strength and stock is 5 milligrams. So it's 5 milligrams for every 1 ml times 1. 5 goes into 7 one time, leaving behind 5. Okay. So I've shown my working out, and I've got 1.5 mils I need to administer to the patient. If you can just confirm that for me. I've got 7.5 strength required, strength and stock is 5 milligrams. The volume to be administered to my patient is 1.5 mils. That's right, I agree. I'm now going to undertake my second drug check, if that's okay.
Yes.
I have got the correct patient, Kane Dobson. We've identified he's got an allergy to penicillin. He's wearing a red armband. I've validated the medication order, this is correct, and I've done my working out, which you've agreed to. So I'm just going to do my second drug check now. Okay. The doctor's ordered morphine hydrochloride trihydrate per oral, dose of 7.5 milligrams, due 6 hourly. Today's date and time not yet given, it's his first dose. Indications for analgesia, patient's got a pain sore, 6 out of 10. Doctor's signature, doctor print and contact numbers. I have got morphine hydrochloride hydrate. There's a 100 ml bottle not yet opened. The date for expiry is the 12th 23 and the strength is 5 milligrams per every 1 ml. According to my calculations, I've worked out I need to dispense 1.5 mils.
Okay.
Yes, thank you. Alright. So I'm just going to prepare to get my medication ready to dispense to the patient. I'm just going to bring my trolley over. So what I have here, I've got a syringe which is for oral administration. Do a gentle little shake. And so according to my notes, I need 1.5 mils. One and a half. Got a little bit of air in there. Just expel the air to make it an accurate reading or measurement. So this is not a sterile procedure, it's a non-touch or clean technique. So 1.2, 4 and a half. Can you do my third, help me do my third drug check, please? Okay, so I've just drawn up 1.5 mils. If you can just check that dose for me.
Yes, that's
1.5
right.
mils, thank you. Alright, yeah, I've checked all that. Alright, so that is my second drug check. What I'm going to do now, if it's okay, I will do my third drug check and then I'll write the details in the ward register.
Okay.
If that's okay?
Yes.
Okay. So again, I've got the correct patient, which is Kane Dobson. I've already verified his details in his first patient check. Identified he's allergic to penicillin. He's got a red armband on. I've previously validated a medication order and I have today's date, morphine hydrochloride as the doctor's ordered. Per oral, 7.5 milligrams, 6 hourly. Today's date, not yet given. Analgesia is the indication for pain relief. His pain score is a 6 out of 10. Doctor's signed, doctor's print, contact details not yet given. I've worked my calculations out to 1.5 mils, which I've agreed on. And I have morphine hydrochloride trihydrate. It expires the 12th 23. The strength is 5 milligrams in 1 ml. The bottle itself has got 100 mils. We've just opened that, and I've drawn up the dose of 1.5
Okay.
mils.
Okay, good.
I'll just put that there. Are you happy if I return this?
Yes, I'm happy.
I'll just fill in my documentation now for the essay. Just take the keys with me, the cupboard's locked. Okay, so I've checked the MEMS. I'm now just going to check the patient's SAGO chart just to check their observations, which I've done just prior to meeting the patient to do his analgesia checks. Just checking his SAGO chart. He's between the flags. Saturations on the room air are 98%. Respiratory rate was 18 breaths per minute. And everything else looks okay. So it seems that it looks good or safe to give to this patient. I don't need the ward register, so I'll leave that at the drop cupboard. Okay. Do you mind accompanying to the patient, do a patient check while giving his medication? Thank you. Hi, Mr. Dobson. I'm back with your medication. I've just got another nurse with me at the moment because we have to have 2 nurse checks before I can administer it to you. Could you please confirm and go through your name and date of birth again for me, please? You just check. I've got Kane Dobson. Kane Dobson, MRN is 0956742.
0956742, Kane Dobson.
Date of birth is the 31st of the 3rd, 1994.
31st of the 3rd, 1994.
And he's wearing a red armband.
Allergic to penicillin.
Okay, we've got that for you. Okay, thank you, sir. Are you happy to sit up like this? It's an oral preparation. So what I've got is, I've got 1.5 mils of morphine for you. So it's a strong pain relief since you've had that traumatic incident with your legs. It can give you some feelings such as an upset stomach, a little bit of constipation. I've checked your observations. You're within safe parameters to receive this. Are you okay to have your medication?
Yes, I'm fine, thanks.
Okay, fantastic. All right. Are you happy with that?
I'm happy, yeah.
Okay. Just pour a little bit of water for you. Okay, you're right, sir? All right. Open your mouth. There we go. All right, thank you. So that should start to work within, I'd say, 15 to 20 minutes as it needs to be absorbed by your stomach. I'll come back within 20 minutes just to reassess your pain and to make sure your observations are fine, so I'll do another set of obs on you. I'll give you the call bell. If you have any other queries, please let me know. I'm just going to fill in your paperwork and I'll come back.
Thank you.
Thank you, Mr. Dobson.
Thank you, Kane.
Okay, so I've just got to complete that. Happy to cancel?
Yes, I will.
Okay, so I've got today's date and today's time. If you'd like to countersign that for me. Thank you very much.